Nobody wakes up and thinks, I'm going to enjoy myself being a heroin addict today. Nobody wants that, and nobody would wish it on anyone. We designed a training program for community groups, or anybody really, who comes into contact with those that use substances, because we really want to sort of try and work from the inside out and try and get people to understand the whole complexities of addiction and how people get there and how people survive it.
I've been involved in the substance misuse treatment field for 30 years and have represented a higher education organisation with the Department of Health in looking directly at workforce development. We wanted to develop a program that would enable us to introduce practitioners, professionals from a wide range of organisations that have contact with individuals in recovery so they can better engage with them and support their recovery process.
Drug and alcohol addiction really doesn't come out of a vacuum. It comes out of those areas of deprivation where people are socially excluded. Delivering these courses is really about trying to deepen understanding in the public awareness in communities, both professionally but also, ideally personally. For example, through talking to loved ones, most of us will know someone who has or has experienced addiction problems.
We're looking at a strategy around reducing stigma, and to do that you obviously need to raise awareness and knowledge around addiction and why people use drink or drugs. Getting out to the community is a massive part of that. There's myths and misinformation that adds to the stigma. It's trying to break down those barriers to re-educate people. Just because someone is in addiction, it's not the end. It's that there is hope and that they can come back into normal society as a productive member of the community.
I want to connect with my delegates, and I want them to connect with their service users, and how they connect after coming to the peer-led training. I hope, and the idea is that they're going to go away with a different attitudes, different words, different understanding, different mindset around the people that they're coming into contact with.
A lot of the academic research around that is really looking at the process of recovery and how recovery peers facilitate each other's recovery, but there isn't anything that really looks at the recovery peers delivering training to professionals. We're kind of in brand new territory really in starting to develop this and starting to develop an evidence base that hopefully we can build on.
So much is coming out of this peer-led training and connections, because this word connect is what we're doing, we're connecting. And when you've been out of the world, out of life, out of living for so long, to be looked at in some way of respect and honour and competence is it's fulfilling, it's brilliant, it's amazing, and damn, I want more.